Hello and welcome to Talk Africa. Now, international efforts to stop Ebola have gained momentum. The UN has pledged $1.1 billion to ramp up response. China has sent 170 medical professionals and an aid package of $32.54 million in addition to the $37.4 million sent earlier. China will also provide the World Health Organization and the African Union with cash funds of $2 million each. The United States has dispatched 3,000 troops to Liberia to set up a field hospital. Cuba, on its part, is sending over 400 medical staff, and Canada has pledged $30 million. Guinea, Sierra Leone and Liberia have been the countries most affected by the virus, with 7,178 cases and 3,338 deaths, according to the World Health Organization. Now, UN Secretary General Ban Ki-moon says global efforts to fight the epidemic have fallen short. Dr. David Nabarro, the man leading the UN's fight against Ebola, says it is worse than HIV and SARS. If unchecked, it may infect 1.4 million people by January, according to the US Center for Disease Control. Now, so far, these are some of the commitments that have been made. Hundreds of millions from the African Development Bank and the World Bank. Hundreds more from the United States, the European Union, and support from China. Here's CCTV's Jen Keo with more.
6 months ago, it barely registered a blip outside West Africa. And even as the cases quietly multiplied, the world was looking elsewhere. Fast forward to late September, though, and this outbreak can no longer be ignored. In fact, Ebola took the spotlight at the UN General Assembly in New York, sharing it only occasionally with Islamic State. If anyone came to New York claiming to not know what was going on in West Africa, they certainly could not have missed the cries for help.
Viral diseases are no respecters of boundaries in the world of expanding human habitats, bringing us into greater contact with mutating virus. Ebola is not only a disease of Sierra Leone and its neighbors.
We praise these efforts, which are necessary in our countries, but would call for an acceleration in their implementation to help our brothers affected by this health crisis, adversely impacting growth, integration and stability in the sub-region.
The response from world leaders has been equally emphatic.
I want us to be clear. We are not moving fast enough. We are not doing enough. Right now, everybody has the best of intentions, but people are not putting in the kinds of resources that are necessary to put a stop to this epidemic.
China's Foreign Minister Wang Yi also urged the international community to do more. More medical workers, more experts, more protection equipment. In other words, actions, not words. But past experience has shown there can be a vast gulf between what's publicly pledged and what is delivered, when and where it's needed. By some estimates, 20,000 could be sick with Ebola by this time next month. The people of Liberia, Sierra Leone and Guinea simply don't have time for empty promises.
While there are reports that Ebola infection in Sierra Leone is marching on at a rate of 5 infections every hour, a statistic that highlights the still deteriorating situation in West Africa. Well, Nina Devries is in Freetown. She joins us now on the line with the latest. Nina, we understand 5 infections every hour. Pretty scary statistics there. Is that the reality on the ground, though?
Absolutely, yeah, that is scary statistics. And, you know, I've spoken to a healthcare worker about this who says that sounds pretty accurate considering the fact that many cases can go unreported. Sierra Leoneans are very affectionate people, and now their whole culture has changed in terms of touching and hugging one another. Now you just have people say, no touch, no touch. You know, then the message really is getting through to people that things like that cannot be done in terms of spreading the virus. So there is definitely more awareness that's happening, but at the same time there's concern and there's worry as well.
All right, there is concern and there is worry, but what impact, though, has Ebola had on the citizens, especially the children?
There's been a huge impact on children. As some of our viewers may know, a recent report came out from UNICEF saying that the number of orphans is just rising all the time, and it could be thousands and thousands by mid-October. And I've spoken to some people in NGOs here in Sierra Leone who agree with that and say there are so many children that are just deeply affected. Either they've lost parents or, they've been shunned by their communities because they've somehow been in contact with somebody who's had Ebola. One child specifically that I spoke to doesn't know where his mother is. His father has passed away, and he's kind of in limbo at the moment, and he doesn't really know where his home will be. He's being looked after by an NGO, but that's only temporary, and he's just one of many, many cases that are being affected by this.
Indeed, the dire situation in the Ebola-affected countries. Nina Devries for us there in Freetown. Thank you. Well, the World Health Organization has estimated that up to 20,000 people may eventually be affected by the virus. The UN Secretary General Ban Ki-moon said global efforts to fight the Ebola virus have fallen short and urged nations to step up the emergency response to the epidemic. World leaders have pledged $1 billion to combat Ebola in West Africa, saying the response needs to be fast and sustained. So will the support pledged by the international community be sufficient to contain an outbreak of this magnitude? Dr. Nicholas Muraguri, the director of Kenya's Medical Services, will join us a little later on in the program to shed some light on these efforts. But first, Daniel Rangers tells us more from Washington. Daniel?
Well, I want to, Beatrice, first of all, run through some of the raw numbers that are coming out of here in Washington. So from a couple of weeks ago, around $100 million was spent or committed by the United States. The U.S. Agency for International Development committed another $75 million. On top of that, they wanted the Centers for Disease Control to have more experts going out to Liberia to help with the effort. Another $30 million was committed, and then $58 million was requested by the administration for the National Institutes of Health to develop these vaccines that are so desperately needed. Now, I want to bring in Blair Glenclaws. He is the executive director of the Accountability Lab. The Accountability Lab is an organization that normally would work on transparency and accountability issues in Liberia, but they've gone into an emergency mode for Ebola. First of all, can you contextualize all this money? It's very difficult for us here, sitting here, to put this money out there and say how that is actually affecting people on the ground. Can you contextualize that a bit and see explain how effective it is at the moment on the ground in Liberia and the other countries that are affected in West Africa?
Absolutely. Well, thanks so much for having me with you. This is a huge amount of money, clearly, which is what it's going to take to fight this Ebola epidemic in West Africa. But I think money is just one part of the solution, actually. Commitments are one thing, dispersing those commitments and then actually using the money in effective ways is a completely different issue. So one question would be, are these commitments being translated on the ground? And then the second issue is, how well is the money being spent? The US troops who are over in Liberia now, I think, are having a hard time dealing with some of the logistical issues. It's the end of rainy season. It's very hard to get to certain parts of the country. The equipment there is not in ideal condition. So just getting things together to build these Ebola treatment centers is very, very difficult.
One of the issues has been, from the US perspective, is that there's been a lot of rumor mongering in Liberia. There's been a lot of false information, some of it that there is a conspiracy by the US government or by the CIA to spread Ebola. You're bringing in masses of US troops, military personnel. How do you then build those levels of trust, build those bridges to overcome those rumors and speculation?
I think the key is finding trusted voices in society, and that's one thing we're doing at the Accountability Lab, is working with people like, for example, local rappers who have a very legitimate voice with the younger population in Liberia. That's over 50% of the 3 or 4 million people that live there, who can talk to them in a language that they understand, can explain what's happening. And there are international agencies that are doing this well. UNICEF, I think, in Liberia is doing this very well.
And so what would you say now is the priority in terms of making sure that these funds are effectively transparent and are effectively used so that it can affect the most people, but also reassure members of Congress who are still not sure what's going to happen to all of that money? How do you balance that out? Because people are dying every day. it's exponentially worse every day because the spread continues unless you get those personnel on the ground. So how do you divide that up and work out when you can deploy?
I think the US needs to put in place its own systems for transparency and accountability at this side. And then in Liberia, I think it needs to support the government to build the capacity, put the arrangements and organizations in place to manage the huge amount of funds that are coming in a way that is transparent, that makes sure that it indicates exactly where the money is going, who's spending it, and so on. And that's a process that has been underway for the last 10 or so years since the end of the war in Liberia, but clearly wasn't good enough. And I think at the heart of all of this is a crisis of governance as much as a crisis of Ebola. And until we get to grips with putting these systems in place and helping people understand how to manage funds and how to build capacity for governance, then we're going to have a lot of difficulty, not just now, but in the future with healthcare crises of this sort.
Blair Glenclawes, thank you very much for joining us. And Beatrice, really the challenge, the message here is that despite all of the funds that have been committed by the international community, there are still major challenges in translating that into help on the ground that is both transparent and also effective, given the challenges that we have in these countries.
All right, Daniel Ranges for us there in Washington, D.C. Thank you very much on global efforts to keep the virus in check. We'll take a short break here on the program. When we return, Kenya's Director of Medical Services will tell us more about Africa's efforts.
There are several ways to avoid being infected with Ebola. Good hygiene is important, so washing hands regularly and using clean towels. Ebola is spread through bodily fluids, so avoiding shaking hands and avoiding contact with a victim of the virus are highly recommended. Not touching the deceased and keeping a good distance at funerals are also measures that should be taken. Finally, panic is one of the biggest threats when it comes to this outbreak. It's essential not to spread rumours about the virus. Health workers are there to help, not hinder, and people in affected countries should at all times try to remain calm.
An entire region under siege.
On the villages and shanties of Sierra Leone, Guinea, and Liberia.
To the sprawling cities of Nigeria. And this is a taste for all the people of Africa.
The comprehensive and exclusive coverage of the worst Ebola outbreak in history.
And how Africa is rising to the challenge. Follow us, CCTV Africa.
It's very important to understand, though, if UNMIR was not created, if the world was not responding now, Ebola would continue to spread. The spread of Ebola would not stop.
A stark warning from the head of the new United Nations mission to fight Ebola. Anthony Banbury and his team arrived in Ghana this week. This will be their mission headquarters.
The UN mission now really has just one job: to stop Ebola, to prevent it from spreading. When that job is accomplished, this mission will close up, and the sooner that happens, the better. However, we have a big job ahead of us, all of us, working together with all the actors, governments, aid agencies, to achieve that job, to stop it where it is and prevent it from spreading elsewhere.
In 6 months, Ebola has killed more than 3,300 people in Liberia, Guinea, Sierra Leone and Nigeria. The scale of the crisis has overwhelmed local healthcare services. UNMIR hopes to provide the logistical support to help them contain the disease.
UNMIR is an unprecedented mission created by the United Nations to deal with this massive challenge that we currently face. No one could have predicted what is happening today in Guinea, Liberia, and Sierra Leone. And we're all grappling with the response to this.
This UN mission will partner with agencies already working on the ground, such as the African Union, the World Health Organization, and other medical NGOs. It'll work as a coordinating body, identifying logistical gaps and filling them with resources. It says it needs to identify those needs quickly before this crisis becomes even more complex.
Ebola has become a multidimensional crisis, presenting serious risks in the economic, social, humanitarian, development, political, and security spheres for the three most affected countries.
UNMIR has set itself a tough target to have all resources in place within 30 days, so that within 60 days, 70% of those sick can have access to medical treatment, and 70% of the dead are given safe and decent burials.
Welcome back to the program. Well, world leaders have pledged $1 billion to combat Ebola. Plane loads of equipment and medical personnel have also landed in West Africa. But Ebola still appears to be marching on. So where is the disconnect and what needs to be urgently done? Now, Kenya's Director of Medical Services, Dr. Nicholas Muraguri, is here to shed some light on this. What needs to be done urgently?
I think there are a number of critical things that need to be done. What we need quickly are health workers to rapidly go down and support the response. We also need a massive community mobilization with volunteers or other networks to ensure that people are able to, those at risk identified, all contacts identified, those who are sick identified and transferred to appropriate level of care. At the moment, money is just part of it. You need health workers, large number of specialized health workers, both nurses, epidemiologists, lab technologists, and everybody, plus logisticians, to ensure that we're able to respond appropriately. So money is just part of it. The human health, the human resources is a bigger piece of it.
All right. The United Nations, though, launched an appeal for $1.1 billion US dollars. There was another conference this week in London on the situation in Sierra Leone. Are these efforts sufficient? Is that money sufficient, though, to keep the virus in check?
It's a good step. The money may not necessarily be enough because it depends on how the outbreak continues. But the outbreak will take place. But it's a good step. I mean, to welcome that, because at one time, there was not enough money. But now the world has woken up to the reality that Ebola is here and everybody is at risk. As you are seeing massive response to the reality people have woken up to. So it's good enough, the money can come, but also the speed at which the money also be disbursed to the United Nations is another issue. But we are hoping that we can get this money can come on board, the mission can be established quickly, and they go out on the ground. Speed is of essence.
What normally, though, is the process here when it comes to such an emergency response and such amounts of money? Who is responsible for what? How does it get to the ground, and what time span? So
this particularly, the UN has set up a mission, the UN mission on Ebola response, that is supposed to coordinate the global response. So anybody who is supporting the response from both money, technical equipment, the UN mission is supposed to coordinate that, because otherwise there can be a lot of confusion, and then the more people that necessarily be more effective. So it's important that it's coordinated. So the UN takes that role of coordinating because of its convening role of the UN. It's able to bring everybody on the table, respond appropriately, able to distribute also the response based on the knowledge they have what's going on. Of course, working closely with the local governments, national government, because it's very important that everybody is brought on board. So coordination is key. So the UN mission is supposed to take that role of coordination.
We are seeing, though, that even though the UN has launched a $1.1 billion fund there, but we're only seeing about 30% of that money, already coming in. Worst case scenario, if the rest of the funds don't come through, what will happen?
Oh, if they don't get the money, we are in for a disaster. Because clearly, in some of the cities and towns and villages, the disease is out of control. So money is required urgently, people are required urgently, equipment is required urgently to be able to respond. Speed is of essence, because every time we delay in identifying those who are infected, those who are in contact with those who are infected, we are all at risk, because people are still moving around, so there's always a risk of spread of the disease. So what has happened and where we are now, we delayed in responding. It was clearly that the country is overwhelmed. Remember, they also just coming over from post-violence environment. And the health system is weak. And that is why we have found the situation where we are now. If you look at Nigeria, for example, they have been able to contain the disease, clearly, because they have their very strong health system. But these countries have just come up from violence. They're just recovering. The health system is weak. That has taken a little bit too long. And therefore the disease just came to an environment where the health system almost was weak, and therefore that's why it has come out where we are now. So what is clearly required is we support them, because even just outside the Ebola, other diseases are still there. We still have malaria, diarrhea, and so on. So the health system is overstretched. So even the capacity to respond is overstretched, and therefore it's important that we are able to come in as a global community to support them, so that we're able to contain. As long as we are not able to contain this disease, everybody is at risk, because we're all connected in one or the other.
And that is the argument, and the question and the criticism that's been coming out. I mean, the world knew that these countries' infrastructure and resources were lacking, being post-conflict countries. Why did it take so long?
I think we should all be ashamed of ourselves. I think people didn't appreciate the magnitude of the problem. People did kind of underestimated the many factors at play in these countries, and therefore we didn't respond appropriately. I want to thank the African Union, the African leadership. They were the first people to say there's a problem here, and you can see even before the rest of the world came up the reality of Ebola, the African Union had already set up meetings to discuss this situation, and already people already started donating money. Nigeria gave out money right at the start of the outbreak. A number of countries, including Kenya, have committed. South Africa, Namibia, many other countries are coming on board to support them. But other than the money, they also need equipment and the human resources to be able to respond appropriately to this crisis. I think we are all to blame. We should have responded faster and earlier than we have done.
How big, though, is the scale of Africa's response? Because we're now hearing about the rest of the international community. Not much has been heard about the African Union efforts, even though the continent is aware that countries have donated personnel, they've donated funding to the West African countries. What is the scale of the African response?
I may not have the dollar figures, but what is clearly this goodwill. We are all committed to stand in solidarity with our brothers in that region. And countries, depending on their capacity, have responded. Those with money have given money, and I think every day we hear new countries giving. Even in their own environment of poverty, they are still giving something. Other countries have provided technical expertise, others have provided equipment of various nature, others have provided other supplies that are essential to respond. And others are sharing their capacities like laboratory, human resource capacity, and so on. Others are even sharing knowledge on how to respond to outbreaks. And a number of countries like Uganda and DRC, they have a history of managing Ebola, so they know what needs to be done. So they have also sharing the experiences, so they're able to respond. So African countries, I must say, were the first one to respond. It may not have been sufficient, but they have stood in solidarity, and a number of meetings have been held at African Union level, but also at sub-regional level. For example, the whole of East African communities, including Ethiopia, met in Kenya to discuss this issue around what we need to do to protect ourselves, but also how to respond to the threat in West Africa. In other words, what we're able to do as a bloc to help the countries already having the outbreak.
All right. I just want to go to a comment by South Africa's President Jacob Zuma at the UN General Assembly, where he did say that we believe that Ebola would have been contained within a few days had it been an outbreak in the developed world. Do you agree?
Totally. It's true. But even worse, this particular outbreak started last year as the new evidence that's coming up. The rest of the world started knowing there's a problem in March. So already, even in terms of confirming there's an outbreak, you were late. We're 4 months late. That is why by then it had spread across 3 countries. By the time we were waking up the reality that we have a problem. And also we have responded a little bit too slowly. People thought the countries could respond. People didn't know the extent because of weak surveillance system. People didn't know the extent of the disease. So people were dying out there in the villages, but people didn't know that is Ebola. It has taken time for people to map out the extent of the disease outbreak. And by then, a number of factors come into play: mistrust of the health system, the weakness in response. That is why you have seen, even because of limited supplies and capacity, even health workers have died. So all those factors, culture, and many other things have contributed to that spread. So it's clearly we all have there are a number of factors that have delayed contributed to the delay. But clearly, if this outbreak had occurred in a country with capacity, and you can clearly see Nigeria how they've responded and managed the outbreak. Senegal also. So the issue of the capacity of the health system is a critical thing. So it had occurred in a country in a developed world. Clearly, I know they could have quickly identified the case and contained it in terms of identifying the contacts, isolating those who need to be isolated, and managing those who are already infected. So all those issues are clearly there. We have limited capacity in Africa, most African countries to be able to diagnose. Like for example in Kenya, a number of our neighbors don't have capacity to diagnose Ebola. They have to bring samples to Kenya. So they already have limited lab capacity. So already it means that there will be a delay. Even if they suspect a case, they're going to have at least 24 hours delay before they're able to know what they're dealing with. And all those factors may actually put a number of countries at risk. And therefore, it's a wake-up call to Africa and everybody that we need to invest in strong systems, including lab diagnostic capacity.
All right. A final point here from you, though. Do you think the epidemic is finally receiving the international attention it deserves, and perhaps it will not be kept in check?
In terms of it become a serious global issue, the answer is yes. In terms of are we responding appropriately? Partially, yes. What will determine the success is how soon we are able to get the money required, the supplies required, the people required to contain the disease. And of course, we need to bring the communities on board, because a number of these are going wrong there. Mistrusts with the health system, it causes people to hide patients who are infected. And in that environment, they expose more people. So we need to work closely, because all this is part of it. The communities affected or at risk must also play their role and collectively work together with all this national support they're getting to ensure we're able to address the problem. So it's not, it's a two-way. So we can respond internationally and support them, but also leadership in that country, communities in that country must play their role, because there are a number of things not going right at the moment and fueling the spread of the epidemic. So all of us must work together.
All right, but Africa remains concerned. What is our biggest concern at the moment?
No, our biggest concern that it's going to take longer than we thought. So it's clearly, the estimate may go beyond December, but I hope we're able to contain it. So the current fear is that transmission is continuing. That's the biggest risk, and therefore everybody then is at risk. And the factors that may be fueling transmission has not been contained. The cultural issues, how people are being buried, the mistrust of the health system has not been addressed. The weak health system that's overstretched every day. The environment, the normal disease burden, as I said, malaria, TB, HIV is still in the context, and therefore the health system is still weak. So our biggest fear today is that the outbreak is continuing. In some of the areas, no clear evidence they are containing, but every effort has been made. So as long as there is continuous evidence of transmission, then everybody is at risk.
All right, Dr. Nicholas Muraguri, the Director of Kenya's Medical Services, joining us here on Talk Africa. Thank you very much for your insights on the program today. Well, that has been Talk Africa from Nairobi. I'm Beatrice Marshall. Goodbye.